Good morning, everyone, and one more time, thanks a lot, Dr. Chang, for inviting me coming to Taipei, and especially it's an honor for me to have a talk with your staff and also my colleague. Yes, but today I have a talk with the PhD and also master student from the TMU, and multiple coming from Vietnam. And I think that today, maybe the same information, but maybe I will talk a little bit more about my journey, because I want to share, because I only a very young fetal medicine doctor coming from Vietnam. And to be honest, I am the third doctor in Vietnam to join in the FMF community. And so it was a picture that I took by chance when the first time I visit Taipei. Maybe you will recognize this road is over there. I really love this beautiful photo. And this morning, I think that it's like a talking that you are tripping. You have a sip. We will talk everything. And you can add, I can answer, and also I will add and you can answer everything related to the fetal medicine journey, because I only at the beginning, I'm not an expert. And so I think that it's not a curriculum vitae talk about me, because it's very short, but I want to share about why I chose fetal medicine and also my passion and the future direction, and also a little bit what I hope in the next 10 years. I come from Vietnam, and I graduated from medical school in 2018. That means that now I'm 32 years old, and to be an obstetrician and gynecologist from Vietnam. And in 2024, I was the head of a prenatal diagnostic unit in the Medical General Hospital. It's one of the leading private hospital in Vietnam, especially about IVF. Yeah. And at the same years, I was admitted to the maternal fetal medicine program in the Chinese University of Hong Kong, and I graduated here. Incoming, and I will become a fellow in the Fetal Medicine Foundation at King College Hospital in London in these years. So, you can see that in 2018, yes, in Vietnam, the curriculum, the program is quite different when it comes to other countries. When we graduate from medical school, we will take an exam, and we have two parts. The first part is to study in residency, and the second part, if you do not qualify or do not get into it, you will come to another hospital or maybe a clinic to work in 1.5 years. I mean, trained to become a general OBGYN. And at that time, to be honest, I was not good enough to become in residency of OBGYN. So I studied residency in the tuberculosis and lung diseases. To be honest, it's very tough for me. And this is a photo of the setup I prepared for a central venous catheter in 2018. I still vividly remember the time, because during about nearly a half years to be a residency in the lung disease, I didn't feel really belong these ways. That means I still feel it's very good in the environment, the mentor, the teacher, and also the staff in the hospital is very good to me. But you can understand, you can imagine that the connection between I and the patient, and also the feeling belong to. I felt that something is not right. It's not right, and So I decided to spend 1 week to do a volunteer in the northern of the Vietnam, in Hà Giang province. Very beautiful. If you have a time, please come here. This is a trip coming from the U.S. A medical team coming from U.S. They came to Vietnam to do volunteers, and they need some volunteer to do an interpreter. And because I know a little bit about English, especially the terminology in medicine, so I decided to spend 1 week to do an interpreter. And to be honest, I think that it was the milestone of my journey. Because when I spent 1 week to work with them, we talk a lot about how to understand ourselves, how to keep going, how to find the right path, and to work not only the title. To be honest, in my country, the residency is a very big title because you have 2 parts. The first part is for resident, the second is for others. So they always thought that resident is always the best. And others who do not qualify for the residency may be not good enough or something like that. So after 1 week, I decided to be honest, maybe about a gap years. I decided to have I do not, brave enough to quit. But I decided to take a gap years. That maybe if I have 1 year to do another job, if I feel something wrong or want to come back, I still can come back to be a doctor of lung diseases. And so before the medical team from the U.S. coming back, the U.S., they gave me a gift. I still keep it. That I can that is Dr. Alicia. I think it's about more than 70 years old now. She took me a lot and talked to me a lot and pushed me to find the right way for myself. Always remember from where you came and those who helped you along the ways. Always give back. Always give back. Always grow and always work in beauty. And these are the rules that Dr. Alicia gave me at that time. A very tough time for me at that time because I do not want to continue to this way, but to be honest, I want to change. But I need some encouragement and also to believe in myself. So in 2019, I officially become the doctor of OBGYN in the south of Vietnam, in Ho Chi Minh City. And I was trained in about 2 years to become a general doctor. During 2 years, you know that I spent 2 years to become a general OBGYN doctor. So along the time, I always think that, so what kind of doctor I want to be, and also the what specialty I want to follow. And this was the first case in 2021. I do cesarean with my mentor. And to be honest, she is the first mentor to me and means a lot to me. And now she is the head of prenatal care in the largest hospital in the south of Vietnam, in Thu Thu Hospital. And she taught me a lot how to counsel a patient, how to know more about a story of the patient, and also other about fetal medicine, especially some invasive procedure, I mean the CVS and amniocentesis. This is the case that I remember a lot, and a dichorionic diamniotic twins during peak COVID-19. And one fetus is normal, but one fetus was anencephaly. And after thoroughly counseling, and the couple decided to do the selective termination, and the other baby was born at 39 weeks. And after You know that after the baby was born, we still keep connect, you know that I really love the concept and the way we can talk, we can keep contact and understand more. It's not just about the relationship between a doctor and a patient. I do not think so. Maybe it's not every patient, some patient. And now the baby is 4.5 years old, and this photo was taken about 5 days ago because they organized a farewell party for me before I go to the UK. And I will just keep this memory in this photograph. So why I choose fetal medicine? I think I always ask myself that what kind of doctor I want to become, OB or GYN. And the first, I want to become a fetal medicine, a obstetrician. But you know that obstetrician is very, very big, very big. So when thinking about because to be honest, I think that I love talking and sharing. And in OB, sometimes the baby have some problem and they need to talk like a friend, but share the academic knowledge. So I think that maybe this is an area, a very small area I want to spend more time to train myself first. And after I know myself more, I will share with the patient. And also the fetal medicine, the diagnosis will miss some uncertainty. It's also the areas that science with emotion, ethics, and especially at the more vulnerable moments of loss of family. And I want to accompany with them at that time. But I'm not a doctor that know more about psychiatry or something like that, or mental. No. I'm still an OB, but know more about the inner self. And what I am passionate about is I think it's a long path about the diagnosis, screening, diagnosis, and genetic or counseling, communication, or fetal therapy. I think lots of things we have to learn, and it's a lifelong learner. I cannot, and also I think that all the time we cannot learn at the same time, but because we really need lots of things to learn, so I think that I have to separate them and continue to learn every day. Yeah. So it's not only about I think that ultrasound is the first key that we can communicate with the patient, like you said yesterday, with OB. Ultrasound is really truly a physical examination because we cannot communicate or talk with the baby. Apart from it, the knowledge about the genetics. Genetic, I think, is very complex, very difficult. So because it challenged me, so I feel it's more appealing, it's more beautiful to continue to study about this. And counseling is not only about information, it's not about the academic information, but it's the word is kind of that how can we translate from the academic knowledge into a very simple way for families to understand this correctly and thoroughly. And so I think that when I combine everything, fetal medicine is a way of accompany with families. Back to 2025, this is the photo I spent with my friends, new friends in London. The lab photo I was taken with Roberto and Natalia. Roberto is the guy in the middle. He graduated from Oxford University, and now she is the fellow in King's about to become a pediatrician. And Natalia coming from Italy, and she is the fellow in the King's right now. And maybe I will. In the right, the photo on the right is the observer. I spent 2 weeks to observe in the King College Hospital that last year, and it was a very beautiful time for me because one more time I really want to say to myself that it's the right path I want to follow. Maybe I study, I attend some conference, met some expert, but truly when I physically in the, that in this site, in this hospital, I really feel connect and belong, and I will want to spend 2 years. But at that time, I would not admit it because after coming back, I applied for this scholarship. I mean, the Fetal Medicine Foundation Fellowship for 2 years. And yes, sir, really, it's an honor to me to take a photo with Professor Kiproti like this. Yeah, he is so kind and so humorous. I think that no words enough to describe about him. If you have a time to talk with him, I think you only need about 2 or 5 minutes. He can understand about your style. Your style. Only 5 minutes. Only 5 minutes. He can understand about you, who you are, what kind of character you are, and he will talk with you by a very appropriate way and to put you more. And I really admire, and I think that you are the same. So why I choose King's? Yes, King's and our Fetal Medicine Foundation is one of the world's leading center in fetal medicine, and also with a very high quality educational resources. And especially during 2 weeks in King, I observed clinical care, research, and teaching, and really beautiful and really good. So it's the reason I want to apply for this scholarship, and luckily I was admitted, and to begin my journey in June for the next 2 years. So in this slide, I only want to emphasize one thing: is the more human, because we have nowadays we have a lot of advances in not only in ultrasound but also in genetic testing or everything to support the doctor to know more about the fetus. But I think that the more we can use, the more we can study, the more we have to explain or provide to a patient in an appropriate way. So that means more personalized, therapeutic, integrated, or equitable, everything. And how to understand, I think so. So in the next 10 years, I don't know, but I always want to say to remind myself that I really want to be humble before every achievement, and connect with the scientific community, and also connected to every patient story. But first, I think we have to be clinically strong. Yeah, the scientific knowledge, the first. If we want to become a good doctor, and alongside, I think that combined with other factors. And my slogan is not perfect that, but full of potential. I think it's not for me, it's for everyone. I think so. We have lots of potential, but maybe we don't know how to find it, how to utilize it, how to open it, how to push it more and more. And these were the photos that we took in Prague in 2025 in the World Congress Fetal Medicine Foundation, Fetal Medicine. And from that time, I met and I know more about Dr. Chang, and we talk and we share. To be honest, I think that is about 1 year, nearly 1 year, to celebrate 1 year to know each other.
Was it in the beginning of the trial at the end of this year?
Yeah.
I still remember them.
Yeah.
Dr. Chang, Dr. Vo.
Dr. Vo and Dr. Tang. Yeah, Dr. Tang. Tang. Dr. Yeah.
The female one.
The female is another colleague in my hospital. Dr. Annie. Yes. So it's the end of my talk. To be honest, I do not come here to have a very special lecture. I only talk to my journey to get some. I think that something especially before I start my journey in Kings. Yeah, so thank you.